Obrixtamig is currently being investigated in this space pretty heavily, right? So what is obrixtamig? It's a human IgG-like antibody which has a binding domain at CD3, which attaches to patient's own T cell, and the other domain is a DLL3, attaches to DLL3 ligand on the cancer tumor type, bringing these T cells closer to cancer, causing the cytolytic synapse and cell destruction. Immunotherapy, novel immunotherapy, right? We've seen immune checkpoint inhibitor doesn't work in NECs, pretty poor response rates, but this immunotherapy certainly have different responses so far we've seen. So what's the current landscape of drug development of obrixtamig? Well, in small cell lung cancer space, it's been currently investigated both in refractory setting. The name of trial is called DARION-9. I was one of the investigators on that, and we tested in combination both lurbinectedin as well as topotecan. But more importantly now, when you have an effective drug, it automatically moves up front, right? And that's what we are seeing in a lot of DLL3 T-cell engagers right now, that they're being currently investigated in a frontline with chemo-IO combination, trying to change the landscape for small cell lung cancer. Similarly, large cell neuroendocrine cancer, another sister cancer, small cell lung cancer, often left. It's a very critical unmet need and sort of like in a gray zone. People don't know, should we treat them like non-small cell lung cancer or small cell lung cancer? But it's currently being investigated, and they do express DLL3 almost 70-75% of times. But most importantly for today, we have several studies that are looking at EP-NEC patient population. Obrixtamig especially is now being tested in the expansion phase in DARION-5, which is a phase 2 clinical trial. I'll get to it in a second. And again, just like our small cell lung cancer, when a drug works, we want to bring it up front. So there is a phase 1 clinical trial called DARION-7 that tested obrixtamig in combination with frontline platinum-based chemotherapy, and I'll show some results. It is important to know what we have learned from early phase 1 data through obrixtamig is that DLL3 expression matters in EP-NEC for obrixtamig, and DARION-5 is now only including patients with high DLL3 expression, that means 50% or more. However, that is not the case in DARION-7, where we are adding obrixtamig to chemotherapy. So our threshold is certainly low, because we are adding to another active regimen. So they need to be positive for DLL3. So this is the first in-human study that tested obrixtamig in neuroendocrine cancer patients, small cell lung cancer, large cell, and EP-NEC. So it was a big cohort, international study, a lot of centers involved, and it was a dose escalation study. What we know so far, and these are the data that was presented recently, Dr. Capdevila from Spain at EP-NECs, you can clearly see difference in waterfall plot. Patients who had high DLL3 expression did remarkably better with 40% response rate, as compared to just 3% with low DLL3 expression. This is very critical information, and we need to use this to refine further drug development, at least in EP-NEC space. At least that's true for obrixtamig. More importantly, how did these patients do? Well, these are the swimmer's plot, and the patients who had high DLL3, deep, durable responders. Some of these patients continue to be on it, right? So at this point, DARION-5 is now moved into expansion phase, and they are accepting patients who are progressed, at least one line or more, and should have a high DLL3 expression, which is done through central testing. So patients should have archival tissue to be able to screen them for high DLL3 expression and then can get enrolled. It is very, very challenging right now. Let me tell you, these patients are desperate for DLL3 T-cell engagers, and unfortunately, you just cannot get tarlatamab approved off-label for extrathoracic, right? So the only way to get these patients T-cell engagers through different clinical trials. So please keep your radars up for not one, but several clinical trials that are happening in US and outside for these patients. All right, quick word about DARION-7. As I mentioned earlier, this is a study that tested obrixtamig in frontline with platinum doublet, right? So if you have an effective drug, you want to bring it sooner, hopefully not wait for cancer to become resilient, resistant, and very refractory, right? And the study design is pretty straightforward. 1 round of standard of care platinum doublet was allowed because it's a fast-paced disease, so you can't wait for trial enrollment all the time. But once the patient got enrolled, 1 to 6 cycles of chemo plus obrixtamig followed by obrixtamig maintenance. So guess what did we see? Well, these kind of waterfall plots are any oncologist's dream come true, right? Certainly mine. So I recently presented these data at SITC a few months back. Amazing waterfall plots with close to 75% response rate in combination platinum doublet. Now you may say, Aman, you've been disingenuous, right? You also gave chemotherapy. So these are responses from the chemo, right? Not from obrixtamig. Well, wait here. Look at the median duration of response. And you saw Dr. Strasberg's data, right? These patients, the median survival is 7 months. Imagine in frontline setting, the median duration of response is 8.8 months, when historically, this is around about less than half of that. So clearly, there is effectiveness, and these obrixtamig is causing, not only helping us with responses, but its durability of these responses. So certainly, very, very promising signals there. And it's not just obrixtamig, right? This is another DLL3 T-cell engager. It's called eviltamig, and very similar results from their early phase experience. Patients who have high DLL3 expression tend to have much better responses as compared to low DLL3 expression. So again, it's not just one drug phenomenon. It seems like there is real value in assessing DLL3 expression and stratifying based on that. What else do we have cooking with the DLL3 T-cell engager? We have another drug called gosetamig, which is a tri-specific antibody. So it has 3 arms now. One attaches DLL3, others to the CD3 positive T cell, and the third one to albumin. And the theory is that it will stabilize the drug and kind of keep it, increase its half-life. And it's currently being investigated in an early phase trial, so it's a little bit very, very early data. So they are testing in small cell lung cancer in combination, as well as a broader study which is taking all sort of neuroendocrine cancers in the single monotherapy evaluation. This is some of the early data that is now public knowledge from gosetamig, and you can see the drug certainly has activity. Now, what is important to note here is they included neuroendocrine carcinoma of prostate, a small cell prostate, right, which is a unique subentity in itself. And based on their subgroup analysis, seems like the responders don't necessarily have to have high DLL3 or low DLL3. They saw responders in both the categories. So that begs the question, is DLL3 expression important for all NECs, all EP-NECs, or is just a GEP-NECs where it is crucial and process a different biology? Certainly, we have a lot of questions that we need to be answering in next few questions. But overall, seems like the T-cell engager strategy seems to be working there. Last but not the least, I mean, good luck learning all these names, right? They just keep coming up every 6 months. So we have another drug called pelutamig, which is a DLL3 T-cell engager. Here, the novelty here is, though, that this binds to CD47, not CD3, right? So there's this little bit different mechanism here, but the overall concept is same, and they are currently testing it in a broader study called Skybridge study, which is including small cell, large cell, and EP-NEC patient population. Again, these are very, very early in development. Obrixtamig is by far very mature. If you add phase 1 and Darien to phase 2, they've probably treated close to 100 patients by now altogether under all Darien series. But very, very exciting time.